Josh? Great. Welcome to the Center for American Progress. My name is Naveen Nayak. I serve as a counselor at the Center for American Progress and as the president of the Center for American Progress Action Fund. I have the pleasure of welcoming you to today's event, Lowering Costs for American Families. The event will feature remarks by Neera Tanden, Domestic Policy Advisor for President Joe Biden, followed by a conversation between Neera and Emily Gee, CAP Senior Vice President for Inclusive Growth. Good policymaking must be grounded in reality, not the world as we wish it were, but as it is today. So to kick off this conversation, let me take a moment to ground us. Today, the US economy is the strongest in the world. US GDP grew by 2.5% in 2023, outpacing all other advanced economies. Since January 21, more than 15 million new jobs have been created, and it's worth noting that is 3 million more than were projected to exist at this point. For the past 30 months, unemployment has been at or below 4%, the longest stretch in 50 years. And wage growth has exceeded inflation for 12 straight months. In all, our recovery from the COVID recession was the fastest we've had of any recession in more than 30 years. That is today's reality. And importantly, none of it happened by accident. Europe, Canada, Japan, UK, no other advanced country is enjoying this kind of economic strength despite facing the same pandemic challenges. This reality was shaped by the actions that President Biden took, including signing the American Rescue Plan, the Bipartisan Infrastructure Bill, CHIPS and Science Act, and the Inflation Reduction Act. Each historic in their own right and cumulatively charting a new trajectory for the American economy and the middle class in this country. Of course, reality is complicated. As robust as the recovery has been, families still face real challenges, many that existed before the pandemic and others that were exacerbated by it, as well as Russia's invasion of Ukraine. So here are a few more critical pieces to our reality today. Americans pay 2 to 3 times more for healthcare and pharmaceuticals than other countries. More than half of parents in America are spending over 20% of their income on childcare, forcing parents, often mothers, to opt out of the job market to care for their child. And half of all renters are paying more than 30% of their income on rent and utilities. Again, these outcomes are driven by policy choices and actions we do or do not take. The middle class in America does not have to be squeezed like this at every turn. And while Republicans in Congress have refused to do anything to lower everyday costs, the Biden administration has acted. Through numerous executive actions and laws, they have taken steps to cut medication costs, including insulin and inhalers, lower utility and gas prices, and reduce credit card fees and ticket costs. Let's take one more major example, prescription drug prices. Prices have continued to rise in America for decades, despite promises from virtually every administration to the contrary. The Biden administration is the first in generations to take on big pharmaceutical companies to allow Medicare to lower prescription drug costs and to cap costs for seniors. And it's worth noting, not only have pharmaceutical companies sued to block these actions, but Republican leaders in Congress have vowed to repeal them. Lowering healthcare costs means more families can have the peace of mind that comes with knowing that you won't have to skip meals or forego heat or air conditioning to afford life-saving medication you need. But for all the progress we've made, the Biden administration understands that reality demands more be done. Growing the middle class in America means giving more families that security that comes from being able to pay your bills and still having something left over. That sense of security evades too many families in America today. And so we are thrilled to have Neera Tanden here today. There is literally no one in the policy world that is more grounded in reality and attuned to what families are going through. She modeled that approach when she led CAP for 9 years and continues to do so as President Biden's domestic policy advisors. And so we're thrilled to welcome her back today. Here.
Oh man, it's great to be back home. How are you all? Good morning, everyone. Thank you. Oh yeah. Thank you. Thank you so much. It's really great to be here. And I am really just thrilled to be with so many great leaders and thinkers who help develop so many ideas that we are able to capitalize on in the Biden-Harris administration. And so I see old friends here that I worked with many, many years who's done so much incredible work contributing to transformative change in the lives of people. And so I am grateful for the work that we've all done together on those issues. And so I really wanted to come here to talk about a range of issues. As Naveen said, we are hyper-focused, and I really appreciate the introduction from Naveen, who's been an incredible leader in the progressive movement as well. But just to really frame out our thinking as an administration, particularly at the Domestic Policy Council, on issues that are affecting families. And I come to CAP because over its 20 years, CAP has been at the forefront of really framing not just particular ideas, particular policies, but approaches to how we look at what's happening in our economy. And their CAP for decades is really focused on, the middle class squeeze that families face, and have thought through both how particular costs, childcare costs, housing costs, healthcare costs, are a real strain on families over the long term, and have developed ideas that have really ensured that we can lower those costs, not just day to day, but over long term for families. And the president likes to think of this as breathing room. The families are looking for more breathing room as they kind of balance out wages, which have been increasing, real wages have been increasing, but with costs like, and these are big costs for families, housing, healthcare, childcare, as Naveen laid out, big costs for families. So I am excited to be here to talk about where we are in some of these issues and some of the new announcements we have on these in these critical areas. And of course, as people know, healthcare is very close to my heart. So I'm going to start with healthcare. And as Naveen said, we are hyper focused on healthcare costs, and really proud of how we have made healthcare a centerpiece of our work as an administration, but also focusing in on both access and affordability. So we have more people covered by the Affordable Care Act than ever. And I'm particularly proud of the fact that our investments, first in the ARA and then through the Inflation Reduction Act, have made the Affordable Care Act more accessible, more affordable than ever. And that has driven huge results. So just in the last 3 years, we have increased ACA exchanges by 75%. Huge gains of healthcare, but critically, more people have found it more affordable than ever. It's $800. Most Americans have saved $800. And just think about that, a 75% increase. We're now 21 million Americans getting affordable insurance through the exchanges. And that's a critical component, but we've also been focused on taking on prescription drug prices. And this has been a little bit of a more contentious fight. I'm proud of the work of the Inflation Reduction Act to drive a series of actions, Medicare price negotiation. As I think people may be tracking, we will have our first 10 drugs, Medicare price negotiation, on September 1st. That will be a range of drugs that will be delivering lower prices for seniors. But that is not the only action we're excited about. $35 insulin is another area. But today I'd like to talk about an area where we've done a significant amount of work. And I think it's sort of the unsung hero of our work on prescription drugs. And that's the inflation rebate program. So How many people have heard of the inflation rebate program? Okay, we're with a group of nerds, honestly. So it's like we do have 10 people here. How many people have heard of $35 insulin? Yay, that will warm the president's heart that we have so many people. It's a little bit of a selected audience, but it is great. So we're very proud of $35 insulin, absolutely, and that's delivering results right now. But another area where we're delivering results right now is the inflation rebate program. And so let me explain it. The inflation rebate program is a part of the Inflation Reduction Act, and the inflation rebate program essentially ensures that pharmaceutical companies who charge Medicare and seniors prices that grow faster than inflation, they owe a rebate, and we owe a rebate to Medicare, and we ensure lower drug prices for seniors. This program has been operational for the last year, and we have saved, from what we've done so far, since this program began, Medicare has lowered coinsurance on 59 Part B drugs. This is a group of drugs after companies hiked the prices faster than inflation. This has saved many seniors up to $3,575 per dose. We are talking about some of the most expensive drugs. And this is creating real savings for people. And this is an important piece of law that gets a lot less attention. That's why I decided to come to CAP to talk about it. I just want to lay out what this means for seniors. So just consider a senior facing advanced bladder cancer. In the last 2 years, new research, we have new data now that has shown that including this drug in our list of inflation rebates, the drug is called Padcev. This person who needs this for routine chemotherapy, this drug is more effective than any other treatment, but the drug is really expensive. This cancer patient might need several rounds in the course of her treatment, and even worse, Padcev, the manufacturer of Padcev, has been raising the price faster than inflation, which means people have had to pay more, particularly chemotherapy patients. But with the Inflation Reduction Act, seniors who were previously completely exposed to those price hikes aren't anymore. And that's a critical protection. With the new inflation rebate program, seniors get protections from this. And since the program began, a senior taking Padcev as part of her treatment over the last year would have saved $1,100.81. $1,181. Oh my God, I cannot believe I screwed that up. $1,181. And that's real savings to people who really desperately need it. And then let me talk about another example. Crysvita. This is a drug that seniors take, and it's an expensive drug for genetic bone disorders. And people rely on it for this very rare disease. Manufacturers know that people are desperate for this particular drug. So they have a free rein. They have had a free rein to charge essentially whatever price they can get until the inflation rebate program. Now, that program has ensured that a senior using this medication would save $800 last year, a dramatic savings over the course of their needs. So really, this is a critical program, and it makes a big difference. And today, I'm really proud to announce that we have 64 new drugs that we are listing, and those drugs will help close to 1 million Medicare patients save thousands of dollars. In fact, these drugs cover osteoporosis, cancer infections, many cancer, other infections, blood clots, many other conditions, and people can save up to $5,000 per dose. So that is a critical protection for people, and why we are so proud of our work on prescription drugs. But that's not where we're stopping. Prescription drugs are a critical component of what we've accomplished, but we have so much more to do. That's why the president wants to dramatically expand the list of drugs that Medicare will negotiate from 10 to 15 drugs a year to 50 drugs a year to cover as many drugs as we can, and why the president wants to ensure that the 2,000 cap that seniors have today. So next year, seniors will have a $2,000 cap on all their prescription drug expense. He wants to ensure, and this is an issue we will fight for in the next term. He wants to ensure that all Americans have that $2,000 cap. So that's a critical protection going forward as well. So let me now talk about housing costs, because we appreciate that housing has been a huge expense, and rents have been high over the last couple of years. They are moderating this year, but people have experienced significant rent increases. And as I like to say, we know that the rent is too damn high. Okay, I got a chuckle. That's good. And so we have a robust agenda that we've laid out over the last couple of years, the low-income housing tax credit. We're proud of the fact that the American Rescue Plan has really invested resources to ensure that people can stay in their apartments in the time of crisis. But this is an area that is a huge priority for us as we look to the next year, because we appreciate that there is a deep interaction between rents, housing affordability, and supply. And that is why the president has an agenda of ensuring that we are building 2 million more affordable homes, apartments, and houses over the next several years. And his investments we find that when we talk about this out in the country, there's a deep resonance to this. People understand that housing is a significant challenge in every corner of the country. And we really think about this challenge as focusing on building more units, building more housing. As the president likes to say, build, build, build. And as part of that, today, I'm proud to say that the vice president is announcing a new $85 million award to 21 communities that are breaking down barriers that will make it allow them to build a lot more housing over the next several years. So, for example, the city of Fort Worth is leveraging funding to streamline permitting, and Denver is eliminating barriers to creating new housing and creating new dwelling units. Milwaukee is offering development subsidies to build homes available to lower income residents. We're always focused on housing affordability. The president also has proposed $20 billion in a housing innovation fund. That fund is really designed to provide support to cities to dramatically expand their housing in innovative strategies, community land trusts, direct subsidies to housing units that they build, and support with private sector managing. Maryland is doing this. Bethesda, Montgomery County is trying to create many more affordable units using innovative strategies between the private and public sector. And that is a big focus from the president's build, build, build agenda. And then I will close with our focus on childcare. And I'm proud to come here to CAP because CAP's work on childcare has really been foundational to our work in the administration. I'm proud of the thinking that CAP put forward and its framework on childcare, which is essentially to create a universal childcare program in the country where no person would pay more than 7 to 10% of their income. And that is at the heart of the president's childcare vision for the future. The president has proposed in his budget ensuring that no family pays more than $10 a day for childcare. It's huge savings to families, thousands upon thousands of dollars. And I'm really proud of the work that everyone here at CAP has done. And I think I want to say a special tribute to Rashid Malik, who former colleague, who I learned from when I was president of CAP on issues around childcare. He did seminal work on childcare deserts, which really helped people understand how access was incredibly hard for the families who need childcare the most. And I learned from him in so many ways and have just been deeply saddened by his passing, and share my deepest condolences with Rashid's wife and 2 children and all the colleagues here who miss him. Recently, President Biden wrote a letter to Rashid to share his prayers. And he wrote to him, because of your advocacy, countless children will get the chance to build a future of possibilities. And that is really true. Because of the work of Rashid and others at CAP, they really built the argument for childcare that led to the largest single investment in childcare ever through the American Rescue Plan. It helped drive our Care CEO, Care EO, Care Agenda EO, which is a strategy across the federal government to drive improving childcare, access to leave, programs that really drive our care agenda, and fundamentally why the president is focused. And I think you'll see a little bit of this tomorrow. The president is really focused on this deep burden to families. You know, what's irrational about our policies in America is that we ensure that their youngest families have the least resources, and at a time where we invest probably the most towards the end of people's lives. And that's important. We are proud of our investments in prescription drugs for seniors and lowering healthcare costs for seniors. But families, when they are starting out, have the fewest resources and have the most desperate need for childcare. That is why this is a singular ambition of the president as he looks to the future, why we think of our investments in childcare, paid leave, long-term care as critical components, and why affordability for childcare, this area that is such a stress for families, is a cornerstone of our approach to reducing costs for families across the board. And we are excited about how we will be talking more and more about that and the contrast on these issues with others, because we know that this is a real burden. And so finally, I'd just like to say, I wanted to come to CAP because on each of these issues, housing, childcare, healthcare, CAP has been leading the way. I'm proud to serve in an administration where the president is focused on costs, not just everyday costs. We track those very closely, but the kind of overarching challenges that, you know, parents lay awake at night wondering whether they can afford that gigantic childcare cost, or whether they can afford center-based care, or whether women should be, like mothers should be working, whether they can afford to work, and the cost to working. These are the kinds of stresses that may not be the dominant conversation in Washington every day, but they're the stresses families face, the president hears about, and he's committed to solve. And so I'm grateful for all the work that CAP has done to drive the intellectual energy of this administration around these long-term challenges, and for the work that I know we will do together in the future to reduce these costs even more. Thank you very much. Oh, sorry. I feel like being president 10 years, I should have known what seat to be in.
It's musical chairs. I had to ask you to scoot over. Neera, thank you so much for coming here today. It's very special to me that you came here, and I've always enjoyed working with you when you were here. You're somebody who has a clarity of vision and a drive that is special, and I'm glad to see that you're taking that to the administration and putting that towards lowering costs for Americans. So you talked about 3 areas: childcare, housing, healthcare, and I know the administration released a resource online last week that talks about costs all across families' budgets. So I'm curious if you could talk a little bit more about what motivated the administration's laser focus on lowering costs and making that salient to American families. Why? I know we're at this point where the U.S. economy has made a very strong recovery from the COVID-19 pandemic. And yet, if you look at polls, if you look at focus groups, if you talk to community members, community leaders, people feel like they're still struggling to make ends meet.
Yeah. So, I mean, I think this is, our job in government is to solve problems. And this is a significant challenge families face. I think the president is, he always tries to translate policies into issues into how families are experiencing them, how people are experiencing them. There are people who look at issues at a kind of meta level, but he really does drive down to what does this mean for a middle-class family making $60,000, $50,000, $40,000? How can they afford these things? This is one of the reasons why the president has been so focused on childcare. It's not only that he had unique childcare needs when he had a tragedy in his family and he had to balance a lot and had a lot of resources because he had family members, but he also knows that other people don't have those resources and have to rely on childcare, which is hugely expensive. He's been really taken with the fact that average childcare costs are $11,000, $17,000 in most cities. And so our focus is really driven on what we see, and we appreciate, President is very proud of his economic agenda and the fact Naveen laid out the statistics about how the U.S. economy is driving economic growth for the world. Our unemployment numbers are at historic lows, that we are seeing real changes, real wages have been up. But fundamentally, the most important thing for any economy, when you believe, particularly as the president does, that the economy grows from the middle out and the bottom up, is how people are experiencing that economy. And I think what's really important is, and one of the points I really want to make today is, I think people really experience costs in not just, I think sometimes folks can really fixate or think about grocery costs or other costs, but people are seeing these costs writ large, and they experience prescription drug costs or childcare costs as real heavy burdens as well. And that's why the president, again, our investments in childcare are from the beginning of this administration. It's not that the president thought our childcare challenge was a challenge yesterday. He's been really focused on this throughout our 3 years. And it is born of a reality, which is that people have some challenges with affordability, and we need to address those challenges. And in doing so, we can also meet people where they are. And I also think people hear you more, a little bit more, when you recognize the challenges they're facing. I mean, it is a really big difference, I will say. I don't have a political hat on these days. I am firmly ensconced in in apolitics, but just at a very broad level. Our focus is on lowering costs for middle class families and the ways that they experience it. And when you look at the budget of the other side or kind of some of the proposals, those proposals really mean increased costs for families, increased childcare costs, increased healthcare costs. Repealing the Inflation Reduction Act would mean increased costs on prescription drugs and a whole host of other areas, including utilities. And so there's a lot of rhetoric about these issues, but what's really vital, and I think you'll see President talk about this tonight and tomorrow in the future, which is that we have a vision for lowering costs for families, and we have proof points of how we've demonstrated that, but we also know there's more work to do, and that will guide his second term.
To pick up on what you were saying about the IRA, the Inflation Reduction Act really is a monumental accomplishment of this administration.
Thank you for saying that.
It is. It's a historic investment in combating climate change. It's lowering energy costs for American families and helping accelerate that transition to clean energy and promoting good jobs. It's also lowered health insurance premiums and led to the record marketplace enrollment you talked about, as well as the 64 drugs that will have lower co-insurance for the next quarter. You also mentioned about what's next on the agenda for prescription drug reforms, perhaps extending negotiation to more drugs, $35 insulin for everybody, not just those with
Absolutely.
Medicare. And then the original HR3 bill, as well as the Negotiation Plus cap plan that I'm sure you're familiar with from several years ago, envisioned negotiation and drug reforms not just for Medicare, but also for the commercial market. So I'm curious if you think, what the prospects are for Congress taking up that fight again to lower prescription drugs for costs for more people and more drugs, and being able to stand up Big Pharma again, as they did for the IRA.
Yeah, no, I should say, we are in a consistent battle with pharma. So what pharma was not able to accomplish in Congress, it is working in the courts. So far, even with Republican nominated judges, we've held strong, but we have a very activist federal judiciary, so we have to remain vigilant. But I'm really proud of the successes, but I'd say in policymaking, the only thing that creates dramatic expansion is success, right? So I feel, this is why the president is in his budget. We've seen how our work on prescription drugs is important, effective, and salient, and that builds more congressional support for action. We are proud of the fact that we have gotten the 2,000 limit. We want to expand that, obviously, to all Americans. We're proud of the Medicare drug negotiation. That's why we want to expand it. So I think what we'd like to see is continual action by the Congress. And again, one point I'd make here is that I think people, lose sight of the fact that we really just need, we need just a few more votes. Congress is the numbers are very close. We just need a few more votes in each branch, in each house. And, we could very well see dramatic action on expansions of prescription drugs, but also really dramatic action on childcare, on housing. These are areas where there's broad support in the Democratic Party, and, a future Senate, a future House could see significant action. And again, I should remind everyone that all of our investments are fully paid for. And so we have a roadmap for actual, pushing this forward aggressively.
Another area where you talked about roadmaps was childcare.
Mhm.
And let me also say, I was very touched by your tribute to Rashid Malik, our late colleague here
Oh, yeah.
at Center for American Progress. We miss him dearly. And I'll say he leaves his imprint on CAP, not only in how to be a good colleague, but also setting a very high bar for what thorough research, analysis, and policy proposals look like. And another legacy of his that will live on is his research on childcare deserts, which is the idea that there are some areas of the country where there simply aren't enough childcare providers to serve the needs of children and families. And so currently about 1/2 of Americans live in childcare deserts, meaning that for every 3 children who need childcare, there's 1 or less licensed childcare slots available. So this is a real crisis in parts of the country. So my question for you, Neera, is as thinking back to your time here, passing the ACA, advocating for it, helping formulate it, what would it take for those of us who are advocates in the room for childcare or policymakers to lead a similarly bold push for the types of policies that you have outlined in the president's budget for childcare?
Yeah, so let me say a few words about the childcare infrastructure, and then I'll try to go to advocacy. So the childcare infrastructure in the United States is very insecure and vulnerable, right? Because in the United States, families, the vast majority of families have to use after-tax dollars, meaning, it's just the money they have left over to pay for childcare. This is very different from most of the world. Most of the world, there's much more national, federal investment, state, federal investment in childcare. So in the United States, we are a little unique in the world in requiring families to basically bear this burden by themselves to take care of kids. And that leads to that instability in funding. It leads to under-resourcing. Under-resourcing means lower childcare salaries for childcare workers. It means less income for childcare centers, childcare facilities, and we see a big churn in childcare facilities. So we're very focused on affordability for families and childcare, but we should be clear that in a system where we are investing significantly in support for childcare, that will create a lot more stability in the system. It will create higher wages for people who are working. It'll create more childcare centers, fewer childcare deserts, because there'll just be a lot more resources that can pay for childcare. And we are investing thousands of dollars per family in childcare. Now, how do we build this? I have to say, I was very proud of the Inflation Reduction Act. It was a little bit, it was a little sad to me what was left. But that just is a reminder that we have to build broad coalitions. Childcare is an area where childcare, paid leave, long-term care I think one of the challenges of this has been that these issues have been seen as somewhat softer women's issues, et cetera. Now, women, again, 50% seems like it should be a large coalition. But I do think that we have to think through how we are making deeper connections between our childcare system and investments over long term. Because one of the challenges is that childcare is a deep stress for families for a set period of time. And we have to build stronger connections between why people have to care about a cost that is more episodic than just general healthcare costs. And I think that is a big challenge for us. But it is one where when you ask people, when the president talks about this on the road and people ask him or he just talks about how it works, it's very resonant with people. He hears a lot about it. People talk to him about it, rope lines. Nothing matters more to the president than what he hears on a rope line. So he hears about it a lot. It is a resonant issue. And that's why I think we can build my deep hope is that we build support over the next several months. And so it is a top tier issue for Congress because it will be one for the president.
Another top tier issue you mentioned is housing, and also this idea of growing the middle class. Many Americans associate one marker of being a middle class or achieving middle class status of owning a home. And that is out of reach for too many Americans. Not only home ownership, but also rent is historically very expensive. Can you say more about the administration's proposals to tackle housing costs? I thought the pro-housing program grants you rolled out this morning were very rewarding innovation of local governments and municipalities and lowering regulatory barriers and permitting barriers. What else is on the agenda for affordability?
Well, we have a robust agenda on housing, and I talked about a few of them. I guess I would just step back and say a few things about where we are in housing. So we've had a huge gap in over the last decade in creating enough units. So we have a big housing gap between the units that would fill demand and the units we have. It's about 2 to 3 million units. So that's units across apartments and houses. So that's really what's driving a lot of our affordability challenge is that we just have that housing gap. Now, our housing gap is reducing. So we had the highest rate of housing formation last year, 1.7 million units across apartments and rental and housing, houses. And so we are accelerating that, but we still face a significant gap. So rents now are stabilizing. We expect rents to be 2 to 3% this year. But that comes on top of significant increases, 10, 20%, 30% over the last 3 years. So that's, people legitimately frustrated with rents going up that much. Now, the way to get rents down to like even approaching pre-pandemic levels is to build a lot more units. We have to ensure affordability is at the heart of what we do when we in the federal government invest a lot more in housing. But that is what the president's approach really is. Low-income housing tax credits, this innovation fund, which would basically subsidize areas to have large-scale apartment construction with innovative models. But again, with the idea of apartment construction, president has a innovative tax credit for the next 2 years because we know interest rates are a real significant challenge for families right now to be able to access that first home or even consider selling a home. So that's why the president has a $400 a month, $10,000 over 2-year tax credit to basically allow people to better afford, that deposit or that investment for a house. So, we have a multifold strategy. It's focused on building more units, ensuring affordability, getting more access, making housing, accessing your first house affordable. That's a multi-pronged strategy, but it is really focused on reducing costs for families. That is our North Star on housing. And this is something that the federal government can put money down on the table and we have put a lot of resources, but we all need to encourage state and local leaders to do this. This is a very bipartisan issue. Democratic governors, Governor Moore, Governor Newsom, Governor Healy, whole ranges of governors are really pushing. There are Republican governors as well. And I think this is an area where we hope to see bipartisan action. Again, we could, if Congress ever let this tax bill through, we'd see hundreds of thousands of more units from the low-income housing tax credit, which is desperately needed as well.
It's such a struggle for so many families. And so we look forward to working with you to try to make those a
Great.
reality.
Yay.
We are now ready to take some questions from the audience. We've got the online chat is available for anyone who wants to drop in questions there. If you're in the room and have a question, feel free to raise your hand. And my colleague Josh over here will bring you the mic. So just wait for the mic and we'll get your question.
Please say your name and affiliation for your question.
Hello, I'm Sharon Kotak. Thank you for this presentation. And I think what Biden has done is totally wonderful. And my question is why people don't know about it and why he doesn't get any credit for it.
This is the first time I've heard this question. I think, I mean, I could maybe talk for 14 hours about that, but I'll try to boil it down. Well, I think part of what the president will do tomorrow night is talk about some of these issues, not spend all of his time on every accomplishment, but to talk a little bit about what we've been able to do. I think in the course of the campaign, I'm not here to talk about the campaign, but I imagine in the course of the campaign, there'll be advertising and other issues on these. And also, I do think we have a challenge, which is particularly in this very polarized environment, people do media coverage, people really gravitate towards areas of conflict. And, we'll see whether my announcement of the 64 new drugs that are subject to the inflation rebate are making CNN next hour. But if not, it might, they might be covering other kind of bigger conflicts. So I think we do have just a challenge with good news. But I also think, things that are impacting people more immediately, like the $35 insulin, people are, that does resonate. And we have to do both things. And I think we'll see this more and more. We have to describe what we are doing and what our vision is for the future, but also really describe what's at stake here. I mean, there's sharp contrasts. And maybe when we discuss that sharp contrast, it makes clearer what we've been doing and what our vision is about.
Hi, I'm Robert King with Politico. I had a quick question for you about the $2,000 cost cap. Are you concerned that the cap could inadvertently lead to higher premiums for Medicare Part D plans? That's been something that some insurers have been bandying about, also potentially cutting benefits from Medicare Advantage to help soften the blow from the cap.
Yeah, so I just want to maybe to explain this to people about the cap. There are provisions within the Inflation Reduction Act that ensure there are protections for seniors. There's a 6%. There's a provision within the Inflation Reduction Act that ensures seniors' costs are insulated to significant degrees. But we are, of course, closely monitoring. We're not. HHS is closely monitoring this challenge, and affordability is a significant concern for us. So I know they have a range of tools and to manage any of these issues, and we just have to defer to them. But we know it's a real it's a challenge to see any premium increases. I would just again say that the Inflation Reduction Act did understand that there might be some variation in the first year and allow for smoothing of that. So that's a really critical tool that HHS has.
Do we have time for another question from the room or from online? I see.
I think we'll get one more in the room than one online.
I can try and take, we'll take these two and then I'll do one.
Hello, David Smith of The Guardian. Just in terms of for consumers, how much of a factor in costs do you think is price gouging by big corporations, record profits and so on? And if so, what can be done about that?
Yeah. So look, I mean, I think at a high level, we do see that we have both record corporate profitability and record prices. So obviously, just to boil that down, companies are making a choice to charge higher prices. I think, I know Secretary Vilsack was here yesterday. Secretary Vilsack has done really critical work with leaders here and others on possible price gouging, antitrust issues, and the costs of food, meat processing, other sets of issues. We do think that there's been significant challenge where there are significant issues with companies using the last couple of years as an opportunity to charge really high prices. The president has talked about price gouging, and we are seeing that in talking a lot more about this issue. Companies are now announcing, Target and others are announcing reduced prices this summer, which is really critical. And I do think, like any area, when there's focused attention on it, sometimes actors change their behavior. And so I think we will continue to call out those areas where we see that there isn't a economic rationale. So people are kind of extracting rents where they have the economic power to do so. And the president is proud of his agenda on antitrust and others to ensure that what the economy is doing is really serving the needs of consumers and not having situations where consumers are honestly being taken for suckers. That's one of the reasons why we've done so much work on junk fees. And it's also another reason why we've talked about price gouging.
Okay, I think Natasha
So
has
can
a
we just take this one for woman here? I'm sorry. I know it's not my job to I'm going to my old ways here.
Thank you very much. Kemi Oshukoya from the Africa Bazaar. My question is regarding the decision from the Federal Appeal Court on Friday. And I found the ACA unconstitutional regarding enforcing the price on the HIV. So what is the administration plan to deal with such issue if it goes to the Supreme Court?
You mean the preventive benefits decision on Friday? Yes. Yes. So on that issue, look, we disagree strongly with the decision. I think, DOJ is appealing. I think we are optimistic about the appeal process here. We feel like this is another part of honestly, a Republican effort to use the courts to undermine the ACA. We've been seeing that year in and year out for the last decade. We would note that the Supreme Court has had less patience for those cases, so we are optimistic about the resolution going forward. But there is real challenge in this decision, and we are trying to manage the challenge to ensure that there's least impact as possible. But we are fairly optimistic about how this will be received by other courts.
Thank you. If you have time for an online question,
Sure.
my colleague Natasha has it over here.
Hi, so a virtual question related to healthcare. So as you mentioned, enhanced financial assistance through ARPA and the IRA improved affordability and contributed to the record high ACA enrollment. How concerned is the administration that without congressional action, this assistance is set to expire at the end of next year?
Yeah, so this is gonna be a big fight. And I hope everyone who cares about the ACA and the accomplishments so far will ensure that they engage in this fight. We have already really, the president has talked about how essentially it is a choice of Congress whether we are going to drive up prices. This is the choice in front of Congress, which is fundamentally, we know from the IRA and the inflation, the ARA, that we were able to get many more people covered. So I know there's a lot of conversation over the last decade about how we get more people covered, whether people really want the Affordable Care Act. And what we learned is when we price it right, people love the Affordable Care Act. And affordability has meant that we've covered, as I said, 75%. This big increase, 9 million more people covered. Disproportionate, we'll just note, disproportionately high numbers of Black Americans, Latino Americans covered by the ACA. And that means when you have 9 million more people covered, we know healthcare saves lives. So access to healthcare saves lives, access to healthcare insurance saves lives. That means we're saving thousands of lives. This is a choice for Congress. Okay. The choice for Congress is we maintain these investments and save people's lives, or we go backwards and we will see fewer people with healthcare coverage, worse healthcare outcomes, and, higher morbidity. So I think this is a clear choice. The president thinks it's a clear choice. We will be, this choice will be front and center over the next several months. And we know this will be this is a fight we're happy to have because we think this is a cornerstone accomplishment, but not for this administration, but a cornerstone accomplishment for the country. We have the lowest rate of uninsurance in American history. We have the most people covered with insurance in American history. We've gone through Medicaid unwinding, and we have historic rates of uninsurance, low rates of uninsurance in the country. This is an accomplishment that we should build on, not retreat from, and the president is willing to have that fight.
Thank you, Neera, and we'll absolutely be part of that fight and agree that this is no time to be going backwards. Thank you so much for being here to share your news about keeping more money in seniors' pockets, acknowledging the squeeze that American families still feel, and laying a path forward. Always good to have you back. Thank you.